From the makers of vet-recommended Greenies dental treats comes an easy way to support your dog's wellness. Greenies Smart Essentials dry food delivers complete balanced nutrition with science-backed recipes. Greenies supplements, developed by a team of PhD animal nutritionists, offers options to help support healthy joints, digestion, and more. Whether it's mealtime or mobility support, Greenies helps you care for your dog from the inside out. Learn more at greenies.com.
You're listening to Veterinary Vertex, a podcast of the AVMA journals. In this episode, we chat about how lavaging with at least 2.5 milliliters per centimeter of sterile saline reduces bacterial load in a subcutaneous tissue model with our guests, Vanna Dickerson and Cody, Westmoreland.
Welcome, listeners. I'm Editor-in-Chief Lisa Fortier, and I'm joined by Associate Editor Sarah Wright. Today, we have Cody and repeat guest Vanna, who I got the opportunity to meet when I was at Texas A&M a few weeks ago, joining us. Vanna and Cody, thank you so much for taking time out of your busy schedules to be here with us today.
Yeah, thanks so much for having us.
Thank you so much.
All right, let's dive right in. So when I was rereading your article this morning, the first thing that came to mind was the solution to pollution is dilution. And I feel like that can maybe be the title for our episode today, too. So your HAVR article provides surgeons with a reference point for deciding what volume of lavage to use for the purposes of decontaminating a subcutaneous space. Please share with our listeners the background on this article.
Yeah, so surgical site infections are a recurring challenge in postoperative management, with a relative incidence of about 7 to 10% following GI surgery. So while there's things we can do to reduce the risk, such as aseptic skin preparation, prophylactic antibiotics, and peritoneal lavage, the subcutaneous tissue remains a potential location of contamination during GI surgery.
Yeah, I think it's going to be really helpful info for our listeners. So definitely appreciate you both submitting this really important work to AJVR. So with that being said, what are some of the important take-home messages from this AJVR article?
Yeah, so I think for me, when we have a traumatic injury and there's pus or necrotic debris kind of staring at you in the face, I think that's a helpful guide for, okay, I need to lavage and debride until everything sort of looks clean to my eye. But this kind of study came about for me just because I think when it's an incision you created, I had been asked before, well, if I'm going to lavage it, how much should I use? And I said, well, I don't really know. We have guidelines, something like 200 to 300 mils per kg if it's an abdomen that's septic or something like that, but not so much for the for wound or sub-Q spaces. And so for me, the take-home message was really just kind of a starting point. We did find that 2.5 mils per centimeter lavage decreased it at least below that 10 to the 5th per mil CFU count that kind of historically we've said is what we worry about being at risk for infection. But we did find even more reduction in bacterial counts the higher we went, which makes sense, of course. But I think for me clinically, what I'll probably use is something like 10 mils per centimeter, since probably our real patient has a lot more nuances than our little silicone model did.
Really cool that you can model that too, Vanna. Well done. What sparked your interest in SSIs?
Yeah, so for me, I'm currently a vet student, but prior to starting my veterinary education, I worked in the operating room here at Texas A&M, and my entire role there was helping the surgeons to help minimize the surgical site infection risk to the best of our abilities. And having developed that relationship with surgical site infection prevention, and with my current aspirations of pursuing surgery, it only felt right that my project for the Veterinary Medical Scientist Research Training Program that occurs during the summer months here at A&M just had to involve surgical site infections.
Glad you mentioned that, Cody. I forgot you're a vet student. That's super cool. Well done. You talked earlier about what maybe some of the most important findings of the article, but always when we do these things, we're surprised, which then leads to more articles and more hypotheses. What were some of the most surprising findings from this article?
Yeah, I was surprised that the 2.5 mil per centimeter took our bacterial counts below 10 to the 5th. I really thought that was going to be kind of a baby volume that didn't really quite get it and that we would need higher. But so that was surprising to me. I think we talk about a lot in the article and kind of already mentioned it. I think bacterial adherence to these silicone models is not the same as a live animal sub-Q, so that's probably part of it. And certainly there are probably more crevices than we had in our model. So I think still, again, probably I would be reaching for a little bit more, but that did surprise me.
So what are the next steps for research in this topic?
The next immediate step to this project would be validating our model to actual clinical cases. While we believe the trend in reduction with the lavage volumes used in our model can be used to guide clinical decisions on lavage, further investigation is definitely needed to evaluate for these differences. We started with the model because given the relatively low incidence of surgical site infections after GI surgery at our institution, over 300 clinical cases will have to be required to adequately power such a study.
Sounds like a multi-center study to me, Cody.
I see a new project in your future.
Residency project.
Right? There
It'll be
you go.
interesting. Cody, I don't know if you have this experience in your experience as a technician as well, but we have a manuscript in JAVMA that also shows that the vast majority of people, whoever is doing the scrubbing, don't scrub for the recommended amount of time. It's pretty fascinating. Like an observer that they didn't know they were being observed actually timed it, right? And he thought you were scrubbing for the 10 minutes, but it was 5 or 4 or 7 or 8 or whatever it is. So that would be an interesting factor in your next step of research in this area.
Yeah, that's a very interesting thought, how to definitely consider that going forward.
Yeah, I can send you the article, Cody, after this. It's definitely really interesting. Got a lot of attention on social media
Yeah.
as well. So happy to pass that along. So before we start this episode, I was just chatting with Vanna, actually, how I was volunteering at the AI Headshot Lounge at AVMA Convention this year. So AI is definitely at the forefront of my mind, being immersed in it for the weekend. So do you see a role for AI in this area of research at all in the future?
Yeah, I think I thought a lot about this. I've been always letting my student or house officer pick which questions they want to answer, and they always give me this one. I don't know why, but I think two areas. I mean, I'm actually working with our biomedical engineering group here at A&M right now on what they're ultimately hoping will be a machine learning system where you can image, for example, a wound and use data from that to have this machine tell you, I think this wound is going to heal in 2 weeks, or I think X is wrong with the phase of wound healing. So I think that's one area that we potentially could see this. And I think the other thing that could be useful is, especially for a particular practice, it probably would be relatively simple to set up a system where you kind of say, okay, I had a surgical site infection and these 10 cases this year, and use sort of an AI system to look at all of the kind of different variables to look for patterns. I think those are kind of two areas that I could see it becoming useful for infections.
For those of you just joining us, we're discussing decontaminating subcutaneous tissues and linear surgical wounds with our guests, Vanna and Cody.
Hey, Cody, even though you're a veterinary student, you have a lot of training. And how did that help you to prepare to write this article?
Yeah, so my undergraduate degree was in biomedical sciences, but also, like I mentioned, for this project, I participated in the Veterinary Medical Scientist Research Training Program, which is a 13-week-long program during the summer here at A&M. And this program held weekly seminars and topics like scientific writing and statistics, which really aided me when I was first writing this article. And of course, I couldn't have done it without my mentor, Dr. Dickerson.
Yeah, I'll add, I think most of the vet schools run a VMS RTP. So if there's anybody listening that, maybe is a vet student and potentially interested in research, it's a great opportunity.
Very cool. Well, we love to see veterinary students' names in our journals. And Cody, have you heard of our journal awards? I think Vanna has.
I have, yes.
Awesome. Very cool. Great. See, the word is spreading. So for those of you listeners that maybe don't know, we do give awards to students and house officers as well for articles that are published in our journals. So we take rolling nominations. They close in March every year. And then our judging panel looks at the articles and then we select winners. So very cool. So now we got to move on to some, the fun parts, I think, of this episode. As you know, Vanna, I get this question a lot. This is a very important question for our listeners. What is one piece of information the veterinarian should know about decontaminating subcutaneous tissues and linear surgical wounds?
Yeah, so I think it's definitely lavaging the sub-Q or of whatever your wound is, but especially if we're talking about GI surgery, is not going to probably be a replacement for things like packing off the GI before you cut into it, changing gloves, changing instruments for closure. But at least for me, it makes me feel a lot better that it's kind of one more step that we can do to hopefully prevent surgical site infections that's not, giving systemic antibiotics. So I think that's my takeaway from this that I think is important is this is an easy thing that you can do. It's cheap, quick. So something you can add to a repertoire to hopefully decrease your surgical site incidents.
And then on the other side of the relationship, what's one thing clients should know about this topic?
Yeah, so while we cannot predict or prevent the risk of surgical site infections entirely, our hope is that utilizing lavage on the subcutaneous tissues will help mitigate this risk further. Not only can this improve outcomes for our postoperative patients, but it should also ease the financial burden these complications can have on our clients.
Hey, Cody, while we have you, and this will date you maybe, we're always surprised. What was the first concert you attended?
In 2008, I went to the Houston Livestock Show and Rodeo, and I was forced to go to this concert with my sister, but it was the Hannah Montana concert.
I don't think we've gotten that answer, have we, Sarah?
No, we haven't. But Cody, mine was Justin Bieber, like baby JDs, like just starting out, like middle school. Yeah, so that's a fun one.
That's awesome. And Vanna, for you, what's the oldest or the most interesting item on your desk or in your desk drawer?
Yeah, so I have a lot of random things in my office and on my desk, but I think probably the most interesting are my bajillion dinosaurs. Because you just can't have a bad day if you look up and see a dinosaur. You've got to smile. So I have probably 5 or 6 or more in my office.
That's awesome. We haven't gotten that answer either.
See, these are fun. So now that we can do the video and we can actually see what's on your desk. I think that's really cool for our listeners and viewers. Well, just thank you both so much for being here today and for also contributing your work to AJBR.
Yeah, thanks for having us again.
Yeah, thank you so much.
And to our listeners, you can read Vanna and Cody's article on AJBR. I'm Sarah Wright with Lisa Fortier. Be on the lookout for next week's episode. And don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.